Thanks, Dr. Marissa Boeck, for talking to us about your project in Bolivia. Tell us about what you're doing down there.
Yeah, thank you so much for having me. I'm so excited to talk to you all today. Uh, Briefly, what I wanted to talk about first is just injuries on a global scale, since that's what our project is focused on, is trauma and emergency response care in Bolivia specifically, but more generally improving that in low and middle income countries. And so injuries cause anywhere from 5 to 6 million annual global deaths. So that makes about one occurring every 5 seconds. And 90% of these occur in low resource settings like Bolivia, which is a lower middle income country, where I am currently in the city of Santa Cruz. And just to kind of give you an idea of what's causing that, most of it's road traffic crashes, homicides, or suicides.
Wow.
And that really only captures like the tip of it, because really that's only deaths. And underneath, if you've ever seen the injury pyramid, you have so many more that are getting injured that survive and live on with maybe disabilities, and then also those that don't even present to a hospital facility. And so what we're trying to do is, really, data is lacking in a lot of these settings. And so first, we're trying to attack that by implementing hospital-based trauma registries. And so what we're doing here in Santa Cruz is working with currently 3 hospitals. That's where we're starting, to implement this registry, which is from the Pan American Trauma Society. They've developed a model of data points that you collect, and it's web-based or paper-based. And so we're starting that. We did in January the first pilot program, and then now we're rolling it out to 2 additional hospitals. And so that'll give us an idea kind of what's affecting the population here, and really help us understand where people are getting injured, how they're getting injured, which then can help to inform some preventative strategies to hopefully lower those numbers. And then also, we're looking to increase training here of first responders, mainly lay people first responders, because they do have various systems with ambulances, firefighters, police officers to respond to injury incidents. However, it's very difficult to get to those locations sometimes, and so the first people that arrive are frequently taxi drivers or just community members. And so we want to teach them all basic skills that could help a person survive until a more trained first responder arrives, or until they can get that person to a facility. And so my research mentor, Dr. Mamta Swaroop at Northwestern, she developed a trauma first responder course that she gave in a couple different cities in Bolivia in 2013. So we're looking to revise that and give that. And then the third part of our project is to work on just general health system strengthening of the trauma and emergency response system here in Santa Cruz. And so that will involve, first, we want to do interviews and focus groups with the various stakeholders. So that would be people working in the hospitals, community members, and first responders, to try to figure out what they think trauma is, even because the definition of trauma varies across the world. For example, here in Spanish, traumatology is orthopedics. So people, maybe think that trauma is only like a broken bone or something. So we really need to expand on that, because at least by the World Health Organization definitions, it can include drownings, burns, poisonings. All of those are considered as injuries. And those are things we want to capture in our trauma registry. And so you can think, if the people doing the data collection don't even consider something a trauma, then we're not even going to capture that in our registry. So we really want to work with the people who are living in this city and living in this system, to try to figure out what their beliefs and perceptions are of trauma and the current system that exists, and then how we can improve upon it, just by organization, because I know they have a lot of kind of siloed resources, and that I think if we bring everybody together and talk about it and work together, that we can really move towards something great.
Wow, that sounds ambitious. Is this whole project, is this something that a template that's been applied in another place?
So the whole project, yes, in different countries, people have worked on trying to develop trauma and emergency response systems. With the Pan American Trauma Registry, for example, that has been applied in Ecuador, Colombia, and Panama. And I think they're rolling out to a couple different locations as well. Our goal with picking Bolivia, besides having our connections here and interest and passion for the project, is that they've tried people have tried trauma registries in lower resource settings and have found it to be incredibly challenging. And so what we're hoping to do is implement it in a slightly higher resource setting, like Bolivia, like Santa Cruz, to see what methodology works here and to see if we can then apply it to these other settings where there have been challenges in getting it to work.
So what are those challenges that were found in the lower resource settings, and what challenges do you expect here?
Probably a lot. Behavior change is very difficult. It's probably the most difficult thing to tackle in any type of situation. And so I think the main thing is asking individuals who are already, working so hard, that already are just burdened with too many patients maybe, and in these under-resourced settings that are maybe lacking in things that would facilitate the trauma registry functioning, asking them to really believe in us, believe in the project, believe in this system, that it really can lead towards improved patient care and improved outcomes and just improved functioning of the system as a whole, and that there will be, growing pains in the beginning, there always are, but that this will really improve trauma and emergency response care in Bolivia. So I think, getting at the hospitals, we're working with the nurses and with the residents and physicians in the emergency room to help us to fill out our forms for the trauma registry. And so we want to work with them to figure out, what's best to have on the form, what's the best method of collecting all of this, and really working within their existing system to make this a sustainable intervention that they'll adopt as their own. Yeah. And so I think that's going to be a challenge. Also, funding is always a challenge. And so currently we have support from Northwestern through a fellowship I have there, and through the Center for Surgery and Public Health at Brigham and Women's Hospital in Boston. And so they're funding us for research costs for this year. But it's something that we're going to have to work, we're hoping, with the government and maybe other grant providing organizations to keep this project afloat. But we're going to do it. We have passion for this. So.
Interesting. So in the broader view, it seems like surgical access is sort of an ignored component of sort of healthcare development in resource limited areas. Is that the case? I think it depends on who you ask. I think from my perspective, I think it definitely was and still is in many settings, but is getting better. Mm-hmm. Because you kind of allude to something Paul Farmer said from Partners in Health back in 2008, where it's been quoted widely as he said that surgery is a neglected stepchild of global health. Mm-hmm. And so it definitely was. Having people then recognize that this is something that should be focused on has led to an explosion of different documents and movements this year, which include the Disease Control Priorities 3, which is from the World Bank, and that the first chapter was on surgery, which is huge because the DCP-1, released in, I believe, 1993, had no surgery in it at all. So, we've at least overcome that hurdle. There was the Lancet Commission, or is still the Lancet Commission on Global Surgery, which released its report, and they had a lot of astounding estimates based on modeling of data that over 5 billion people lack access to basic surgical care in the world, which is, almost the entire world, and also anesthetic care, which, go hand in hand with surgery. And that this is the worst in low and middle income countries, where 9 out of 10 people lack this access. And just that they estimated losses. They tried to look at cost effectiveness and everything, and estimated losses in these low resource settings in economic productivity, if we don't do anything between now and 2030, is over $12 trillion US dollars. Wow. So, this is something that I think should speak to governments and, organizations in these countries that surgical care and anesthetic care really is a cost-effective intervention that not only improves the lives of their population, but also increases in economic productivity and development. So,
great. So what else would you like to say about your project or surgical access?
I mean, I think that the most important thing to recognize for me, at least over this past year to year and a half, as I've gotten more involved in global health and global surgery, is that we're really all a part of one connected world, and that we will really get so much further if we work together, and that we don't work in these isolated silos, and that if we join our forces and our efforts and our resources, we can really make real impacts and deliver these essential services to people that really desperately need it. And also to realize that solutions that have maybe worked in other places, like high-income countries or even similar resource settings, don't always work where we are. And so really take into account what local stakeholders say to create something that's very sustainable and something they believe in, that's a part of their system. And that we really need to look at history and realize that history does repeat itself, and that, look at successes and mistakes of the past to really hopefully make greater headway this time around.
Very good. Thanks for talking to the Op Report today. Good luck with your project, Dr. Boeck.
Thank you so much.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.